Hi, I'm Dr. Emily Bullock, and I am a clinical psychologist and a ketamine assisted psychotherapy provider. And I'm the owner of Great Salt Lake Wellness and Great Salt Lake Medical Cannabis. And I am so excited to announce that we started offering ketamine assisted psychotherapy, or CAP, at Great Salt Lake Wellness in January 2022. So we've had a lot of interest from patients at our clinic and from people in the community wanting to know kind of what is ketamine assisted psychotherapy. And so I wanted to spend a couple of minutes explaining a little bit more about it and kind of letting people know what types of conditions would be eligible for receiving CAP here at Great Salt Lake Wellness. So ketamine is a widely used medication. It's been FDA approved since the 1970s for anesthesia. It's a dissociative anesthetic. So it's been used in general anesthesia. It's used a lot in just everyday dental procedures. So if you've had a surgery before, there's good chances you've probably taken ketamine, and at high doses, it's gonna just knock you out. We're not gonna use it at those high doses for mental health treatment. We use it at lower doses. So it is a dissociative anesthetic, so it will bring you into an altered state of consciousness, which can be very helpful for utilization in psychotherapy. So it can be injected intramuscularly. It is commonly infused. You can ingest it orally with lozenges, and that's actually how we use it for CAP. And you can also get it in a nasal spray and inject it up your nose. And that is actually the type of ketamine that was FDA approved, officially FDA approved in 2019 for treatment-resistant depression. So the ketamine, the nasal spray. So it is utilized, it has been utilized the last couple of years legally to treat treatment-resistant depression. It's also used for treatment-resistant anxiety and PTSD. And it has also been very helpful in treating suicidal ideation. So we're seeing it used all over the United States in emergency departments. People come in with thoughts about suicide, they get a dosage of the ketamine, and their SI actually goes away. So that's a very exciting benefit of ketamine that we're seeing. Another benefit of ketamine is that you can take the ketamine medication without having to come off all of your other antidepressants or psychotropic medications. So this is really advantageous for a lot of people that don't want to come off of their medications. If you're wondering if you might be a good candidate for CAP, then please talk to your Great Salt Lake Wellness provider. And if you're not already a patient of the clinic, you can always reach out to us and schedule an intake with myself or one of our other therapy providers who are trained in CAP. We'll do an assessment to make sure that you are eligible for it. And then we'll refer you to our prescriber, who will do a medical evaluation to make sure that you don't have any contraindications. And then the prescriber will be able to put in a prescription for the ketamine lozenges, which will be mailed to your house. And then you bring them into your CAP visits with you. Following the intake, if you are accepted into the CAP program, you will meet with your CAP provider 1 or 2 times. They might actually consult with your individual therapist if you do have an individual therapist already. And we come up with a game plan, basically what are the intentions going to be in these CAP sessions, what are we gonna work on? So usually when people are coming for ketamine treatment, they've already been engaged in therapy, they've already been working really hard in their mental health journey. So you probably already know what you need to work on, like what are your stuck points, what are your core beliefs that you really need to work on. And so we come up with a game plan in those 1 to 2 sessions, sometimes utilizing the help of your individual therapist, to figure out what are we going to really focus on during the CAP sessions. And when we're ready to go, then we start the CAP sessions. So kind of how we organize this. So you can kind of think about it like you're having a couple of prep sessions with the CAP therapist, with the medication prescriber to get cleared and prepped and ready to go. Then you're going to have 6 CAP sessions. They're 3 hours long. And the day following the CAP session, you're going to have a 1-hour integration session. So the CAP sessions where you're actually taking the medication, and then the next day you have another integration session where you're not under the influence of the medicine. So you're having 6 3-hour CAP sessions and then 6 1-hour integration sessions the very next day. And we cram all of those sessions into a 2 to 4 week period. That's the FDA protocol. 6 sessions within 2 to 3 weeks is what they did in all of the research trials to get ketamine approved for depression. So that's our intention. We try to get you scheduled back to back a couple times a week for your CAP sessions and your integration sessions. And what you can expect when you come in for your CAP session, you're going to sit down with your ketamine provider, your CAP provider, and we do meditation. Sometimes we might do some yoga, we do some breathing, we set intentions and kind of get you settled down and grounded. And then you'll take the lozenges. It takes anywhere from like 10 to 20 minutes to start feeling the effects. And then for about an hour, you're going to be really deep in the medicine. So we usually don't talk at all during that hour period. Your CAP provider will sit with you in the session and monitor you, make sure everything's going well. And then when you're cognizant enough to start talking, then we will begin to discuss what your experience was like under the medicine. Because a lot of times you're going to have impressions that will come to you, things that maybe you knew before, but that just like hit you really hard, or that you were able to see things really clearly. Sometimes you might kind of go back into memories and kind of reprocess some trauma. So we're able to talk about that. But your CAP provider is going to be with you the whole time, helping you through all of this. And usually people feel pretty good under the ketamine medication. I mean, it does have a rapid antidepressant effect. So usually people do feel pretty good. But just know that sometimes it is going to bring up some upsetting feelings or memories or material. And so that's why the CAP provider is going to be there with you the whole time. So that CAP session goes for about 3 hours. Then the next day you come in and do an integration session where you're talking about it again. Now, ketamine is a pretty amazing medication in that it allows your brain to see things from a different perspective. It helps you to wholeheartedly feel differently about yourself and others in the world. And it can help you to overcome problematic core beliefs or stuck points that you've been struggling with. So a lot of times in therapy, we work on being able to see things from a different perspective, and we try to believe core beliefs that are more adaptive. We'll work on more adaptive cognitions, or we come up with challenging beliefs that we tell ourselves over and over again, but sometimes it's really hard to wholeheartedly believe it. And that can take a lot of practice and repetition over time. It can take years. And so the ketamine medication is pretty amazing in that it helps people to really truly believe those adaptive core beliefs that they've been working on in their personal therapy. So it can kind of just jumpstart your therapy. It can speed up the therapy process and help you be able to see things in the way that you really truly want to see them. So it's a lot of work, in a short period of time. And so you do need to be able to really be ready for it and commit to it. And I do recommend to people that they try to decrease their stressors during the time that they're going through the ketamine treatment. So if at all possible, to kind of decrease your responsibilities at work or at home with chores and childcare and things like that. Really gaining the support of other people in your life and the community around you, so you can really focus for like a whole month just on yourself and your self-care, to the best of your ability. It's hard for us to just kind of stop our lives altogether and just only do self-care for a month. But the medicine's going to work better, and you're going to have better generalization, and the neurogenesis is going to be better if you kind of slow things down, and then you come up with a plan with your CAP provider to really create a daily routine of meditation or grounding or self-care, so that you can be practicing everything that you're learning through your ketamine treatments, and being able to fully integrate these experiences into who you are, and to solidify the new neural pathways that are created through the ketamine medication and through all of the processing and psychotherapy and integration that you're going to do with your provider. So you really want to be able to commit to the ketamine treatment. You want to be able to slow your life down as much as possible during the month period that you're going to be doing your sessions. And the efficacy rates for people that kind of follow the protocol, the FDA protocol, we're seeing results like 60% or greater effectiveness rates. And for the most part, people are having really good experiences with the ketamine, getting a lot of benefit, feeling so much better. And then we are seeing in practice that it's pretty common for people to need booster sessions every few months following that active phase of ketamine treatment. So we kind of will discuss that individually with you and see what the outcomes are, and try to get you the best treatment possible for your personal situation and what you've got going on. So go ahead and email us or give us a call and let us know if you want more information about CAP, or talk to your provider about it. And we're happy to answer any questions that you have and try to see if this is going to be something that could be helpful for you and for your treatment. Thank you.